Hi, everybody, and welcome. Happy New Year. My name is Jennifer Henius, and I will be your program host for today. Before we begin, there are a couple of brief housekeeping items to review, and we would like to share a bit about the mission of our new initiative. The LGBTQ Caregivers Center is an initiative of the Caregiver Wellness Collective, Inc., a new nonprofit startup based in Tampa Bay. The LGBTQ Caregiver Center aims to raise awareness of the unique challenges faced by LGBTQ caregivers and those who care for LGBTQ individuals, empower LGBTQ caregivers to live with pride and dignity, and serve as a conduit for education, wellness, training, and research. The center provides information and resources and delivers training and innovative services to enhance the health and well-being of LGBTQ caregivers. During the course of the webinar, we respectfully ask for all participants to keep in mind that all are welcome here. This is a safe space for all of our diverse caregivers, advocates, and community members. We ask that you hold space for the differences in thoughts and values, and that all audience members listen deeply and actively, and that you suspend judgment while having the courage to raise questions and to reflect on the information provided. This is an interactive session, and we encourage active participation and lively discussion, so please feel free to share your questions in the chat box, and I'll do my best to read them out loud and address them at the end. This program is being recorded, and it will be available for replay on our LGBTQ Caregiver Center website and our YouTube channel. I'll share a link in the chat box to our social pages so that you can follow along and watch this video later. It's my pleasure to introduce our program presenter today, Ms. Amy Cunningham. Amy has been a research coordinator at the University of Washington in both the School of Nursing and the School of Social Work for 25 years. She has coordinated over 20 studies in the School of Nursing's Northwest Research Group on aging. Those studies have explored behavioral interventions designed to assist older adults with a multitude of issues, including insomnia, osteoarthritis pain, menopause, caregiving, memory loss, and dementia. Her current position is with the School of Social Work's Aging with Pride IDEA project, which she's going to share with us today, which seeks to help adults with memory loss and their care partners in the LGBT community. So welcome, Amy. Thank you so much for your time tonight.
Thank you, Jennifer. I really appreciate you inviting me.
Sure.
Okay, so I'm going to go ahead and share my screen. All right. And then I always ask someone to nod if they can see my screen. You can see this? Great. All right. So I'm going to start. There we go. So I'm going to be telling you about Aging with Pride IDEA. And IDEA stands for Innovations in Dementia Empowerment and Action. It's both a research study and a program that we are providing to caregivers and the folks they care for with memory loss. The two investigators on the study are Karen Fredrickson Goldson out of the University of Washington School of Social Work and Linda Terry from the University of Washington School of Nursing. And this grant is supported by the National Institutes on Aging, which is part of the National Institutes on Health. So Aging with Pride IDEA is the first federally funded research study examining ways to improve the health and quality of life for adults aged 50 and older with memory problems and their caregivers in the LGBTQ+ community. So first, I'm going to talk a little bit about caregiving and memory loss in the LGBTQ community. And then I'm going to tell you about the IDEA study and how we're addressing those issues. A lot of people ask, why study this community? There's a rapid growth of LGBTQ+ older adults with Alzheimer's disease and related dementias. LGBTQ older adults have higher rates of social isolation. They're less likely to be married or have children, more likely to live alone. And to be clear, all seniors are at risk for isolation and loneliness, but it's worse for LGBTQ folks, especially as they age. Social isolation is intensified by marginalized populations like LGBTQ communities. Where the older members have experienced social exclusion in less tolerant times and places, they couldn't get married until several years ago and may have been discouraged from parenting and couldn't always speak freely about their relationships. And studies have shown that hiding an important part of who you are can lead to social isolation, loneliness, and depression, which are risk factors for age-related diseases. So in addition to depression and social isolation, LGBTQ folks have higher rates of some chronic conditions and risk factors for dementia, including cardiovascular disease, smoking, and obesity. They're often medically underserved, stigmatized, and vulnerable, and there's a real lack of efficacious research-based interventions for this group. And we know all of this from another study being done by Karen Fredrickson Goldson, which is the Aging with Pride National Health, Aging, and Sexuality Gender Study. That's the first federally funded longitudinal national project examining the health and well-being of midlife and older LGBTQ adults. It's surveying over 2,400 LGBTQ adults between the ages of 50 and 100. It's been going for 10 years and it is ongoing. And much of the data that we've gotten from that study is informing how and why we're doing the IDEA program. LGBTQ older adults are a growing population. It's estimated that 2.7 million adults aged 50 and older self-identify as LGBTQ in the US. 1.1 million are 65 and older. And by the year 2060, the number of LGBTQ older adults will exceed 5 million. 10% of LGBTQ older adults in the study I just referenced reported severe or extreme cognitive difficulties. 38% report moderate cognitive difficulties in at least one area, and 77% report mild cognitive difficulties in at least one area. And LGBTQ Americans were recently found 29% more likely to report memory loss and confusion, two early signs of dementia, compared to their straight counterparts. And there are health disparities among the LGBTQ older adult population. Lesbian, gay, and bisexual older adults have higher rates of disability and mental distress than heterosexual older adults. Lesbian and bisexual women have higher rates of cardiovascular disease and obesity compared to heterosexual older women. And gay and bisexual older men are more likely to experience poor physical health and to live alone compared to heterosexual older men. And this article on the right is just one of the many articles that has come out of Karen Fredrickson Goldson's research group documenting health disparities in the LGBTQ population. Other study findings: 13% of LGBTQ older adults report they have been denied health care or received inferior care. More than 20% do not disclose their sexual or gender identity to their physicians. Almost 2/3 have been victimized 3 or more times. And 59% report they lack companionship. 53% feel isolated from others, and 53% feel left out. LGBTQ adults as caregivers. They become caregivers at a higher rate than the general population. And we've seen that in our studies also. Many LGBTQ caregivers will say they are just doing the right thing or helping a friend or being a good son without having any idea that they are really caregiving. 35% of caregivers are providing care to a partner or spouse, 32% to a friend, 16% to a parent, and 7% to another relative. And caregivers are more likely than non-caregivers in the LGBTQ community to report a disability, depression, victimization, and verbal and physical abuse. Who are the caregivers? Many LGBTQ older adults may not have a relationship with their legal or biological families and are instead supported by their families of choice. They're twice as likely to age without a spouse or partner and 3 or 4 times less likely to have children. About 2/3 of dementia caregivers in the US are women, but in LGBTQ communities, both men and women have high likelihoods of caregiving. And LGBTQ caregivers often have limited legal power and can be excluded from decisions regarding where the person they care will reside or what the health care the person will receive. And then there's different issues among LGBTQ older adults with dementia. Many have hidden their sexual or gender identities for much of their lives, and memory loss can introduce challenges surrounding how they manage that identity and the extent that they reveal or conceal that identity as their memory loss progresses. And I think this is a perfect example of that. This is a statement from somebody in our study. I'm over 50, a trans health activist, afraid that my insistence on being who I am confuses people. I'm afraid of dementia and Alzheimer's. What if I go back to my 10 or 20-year-old self as a girl or a woman? So all of these factors together are what led Karen Fredrickson Goldson to come up with and get funding for the IDEA study. And her statement is, studies show that LGBTQ older adults with memory loss and their care partners are understudied populations. And our project is designed to aid in the development of much needed interventions for vulnerable midlife and older adult populations. So that brings us to the IDEA study. The IDEA study is based upon a proven treatment program. The foundation of it is an evidence-based program called Reducing Disability in Alzheimer's Disease. That study was led by Linda Terry, one of the investigators on the IDEA study. That was done at the University of Washington School of Nursing. And the intervention that was provided to the general population, so folks with memory loss and their caregivers, had some pretty amazing results. It was shown to reduce institutionalization for the person with memory loss. They were able to stay in their home longer, reduce stress for the person with memory loss and their caregiver, and it increased physical activity in both the person with memory loss and their caregiver. So the IDEA program is designed to take this same intervention and add an enhanced component that addresses the unique risks, strengths, and resilience in the LGBTQ community. So we've made some adaptations due to the COVID pandemic. Things changed pretty drastically for everybody back in March 2019. Prior to COVID, we were doing this study just in Seattle, San Francisco, and Los Angeles. When the mandates came out that we could no longer see people in their homes to provide the intervention, we took some time and made some adaptations so that we could continue doing the study. So what we did is we took our coaching and we made it totally virtual. So now all sessions are done virtually using DoxyMe. Session handouts and materials are sent by mail or email. If the person with memory loss and their caregiver do not live together, we still can include them in the program. We can provide a tablet with connectivity if needed. We didn't want to exclude people who didn't have the device or the Wi-Fi to be able to connect with us for the virtual session, so we can provide that. And because we're doing this virtually now, IDEA is available in all 50 states. The nuts and bolts of the program are that there are 9 visits over 6 weeks with a trained coach who meets with the person with memory loss and the person who helps them. Coaches follow up after participants finish their coaching with 4 monthly phone calls. And then there are 5 assessment interviews done by phone over a 1-year period. And that's where we're getting the data that's going to tell us if this is really an effective program for the LGBTQ community. The pair receives $25 for each assessment they complete. So if they do all 5, that's $125.
Hey, Amy, I think I might have lost your screen sharing. I don't know if others can see it, but just if you
Really?
Yeah.
It says I'm sharing my screen.
Okay, then we'll just keep going with it.
Ah, that's really odd. So what are you seeing, Jennifer?
I'm seeing you. So maybe it's perhaps on my end somewhere.
Why don't I stop screen sharing and go back in just in case?
Okay.
I just want to make sure that people can see it. Share screen.
There we go. I can see
All
it.
right. All right. So the coaches, they have 4 primary areas that they address. There's problem solving, which is coaching to identify consistent areas of tension and brainstorm ideas and approaches to improve behavior problems. There's communication coaching, which addresses strategies to improve communication challenges related to memory loss and dementia. There's a low-level exercise program, which includes stretching, flexibility, balance, and endurance to strengthen the body, support independence, reduce injury, and improve mood. And I have to say, people really give us great feedback about the exercise program. And then there's connecting to community resources specific to LGBTQ aging and caregiving. Coaches are also available as a resource by phone or email. They cultivate ongoing resources and support for the caregiver and assist with connecting to local community resources. And they provide a home safety assessment during the intervention. Even though we're not in the home, we still can have them show us different areas of their home, and we can make comments about how they can improve or suggestions about how they can improve specific areas of their home. So who is eligible for the program? The person with memory loss and the person who helps them both participate in the study as a pair. Either the person with memory loss or their caregiver must be LGBTQ+. They do not need to live together, but they cannot be living in any kind of long-term care facility. They need to be living independently. And the person with memory loss must have a diagnosis of dementia or memory loss severe enough to reduce their ability to perform everyday activities. And that's self-reported. We're not going to their primary care health provider and getting a confirmation. It's totally self-reported. And then the person with memory loss must be 50 years or older. The care partner can be any age 18 or older. Examples of pairs that we've had in the program: couples, partners, spouses, an adult child or grandchild caring for an aging parent or grandparent, a friend helping a friend with memory loss, a caseworker assisting a client. All of these are okay as long as at least one in the pair is, is LGBTQ. And because it's a research study, we can't look at the data until we're done to see if it is effective. But the feedback we're getting from participants has been really positive. And I want to read 3 comments that we have documented. The first one: I appreciated gaining understanding about this disease, realistic expectations, and learning communication with someone with dementia. The program is exceptional, excellent coaching, outstanding material. I'm so grateful that I had your support. Just knowing that there's someone who's there for me was so helpful. I feel strongly that Aging with Pride IDEA made such a difference. I was able to receive what I needed. You gave me new things to consider with support. And then this last comment: I love the exercises. Before this program, I couldn't put on my socks. Now I can. something that most of us take for granted that really made a difference in this caregiver's life. So, as I mentioned, the program's being done at the University of Washington Schools of Social Work and Nursing. We have community partners throughout the US who are helping us let people know about this. And the IDEA program is offered in all 50 states. We have outreach resources. We have a great website. It's ageidea.org. Folks can go there and look at a short video that describes the program. They can also take an online screening and answer questions that we'll get the results for, and we can follow up with them to see if they're a good match for the program. And then we have flyers and posters that have all of our information on there. We have a number devoted to the study. It's, I'll go back, 1-888-655-6646, and that is just for this program. So if somebody calls, they'll only be speaking with someone that's involved with this program. We have social media, ready-made posts, Facebook, Twitter, and Instagram. And there's contact information. Again, our phone number, 1-888-655-6646. Our website is ageidea.org, and we have email ageidea@uw.edu, and then my name and number. And feel free to call me if you have any questions, or email me. I'm happy to answer questions. And then, because we're a research study, we have to provide references for all of that data I gave you in the very beginning. So I'm going to go back up here, and then I'm going to stop sharing and see if there are any questions. There we go. Okay, any questions? I'm going to look in the chat here.
No questions in the chat. Just try to provide some information and resources, and your email or your website address there, and the phone number there.
Great.
It sounds like your coaches are pretty central to the program. Can you tell me a little bit more about that? What types of professionals these coaches are? Or are they peer coaches or?
Great question. So the coaches are specifically trained at the University of Washington. They come in for a training. They're from all over the country, and many of them are part of the LGBTQ community. They have been with us primarily for about 3 years, continuing to do this, gaining lots of experience, good experience in doing this. And primarily, they're all professionals working as social workers, case managers. Those are the two most likely professions that they do in addition to doing this.
Okay. And then we have a question here that says, is the program available for expats living abroad?
Oh, that's a great question. We are, at this point, we're not doing that. We are doing the US, 50 states in the US and US territories. But we have to keep it small because it's considered a pilot program. Once we get the results and we're able to go broader, we would like to provide it to folks in other countries. So that's certainly something we're thinking about.
How many coaching sessions occur?
So there's 9 coaching sessions over a 6-week period. And it goes, and we have 2 coaching sessions a week for 3 weeks, and then 1 coaching session a week for 3 weeks. So that's how we get 9 sessions in 6 weeks. And that's the way the program was designed, and it worked so well, we decided to keep that protocol for this program.
And that's one-on-one coaching that happens?
It's one-on-one. It's with the coach and the person with memory loss and their care partner. So it's 3 people. And like I said, the person with memory loss and their care partner do not need to live together. They can be in separate residences. And, you know, a lot of people, I said earlier, a lot of people don't even consider themselves a care partner. It can be something as simple as calling to check on someone a few times a week, helping them go to the grocery store. You know, it doesn't have to be hands-on daily coaching. It can be something even, a little less involved. So we're very liberal in what we consider coaching, and we're very liberal in what we consider memory loss. Folks at the very early stage of memory loss are perfect for this, as are those who are farther along. And a lot of what we're doing for folks in the early stage is kind of preparing them and their care partner for what's going to happen as the dementia progresses. So we do the whole array of memory loss or cognitive impairment.
And how long is this program going to go on?
So we've been doing this for quite a while. This is a 3-year study, and we are coming up on the end of 3 years. So we will stop recruiting folks in February next month. So if somebody is interested, they should contact us as soon as possible so we can go through the screening and get them involved in the program before it ends.
Okay. And then what is the screening process like?
The screening process is done over the phone with me or my assistant, and we simply ask a few questions to see if the person with memory loss and their care partner are a good match. A lot of what I covered in here, the person with memory loss has to be at least 50. There needs to be some sort of memory loss, and we ask questions about what they've noticed. They need to be able to commit to trying to do the exercises. Some folks are not mobile. They're in wheelchairs, but the exercises we're doing are done from seated chair position. So this works out just fine for that.
That's great. And so are those like exercise trainers coming in, professional
The coaches have been trained in doing the exercises. Yeah, they're trained in doing all aspects, the problem solving, connecting them with resources, doing the exercise program. And it's really important to us that the exercises are done correctly using good form. So that's a lot of the reason we want to be communicating with them virtually. And we use something really similar to Zoom. It's called DoxyMe. It's a telemedicine platform. Super easy to use, even easier than Zoom, which is pretty darn easy. So yeah, and we can provide, if they need something, some way to connect with us, we can provide the tablet so that they can connect with us. We're happy to do that.
Oh, wow. And then also there's a gift card, right? I think if you
it's $25 that we send them for each assessment the care partner completes, and those are done online or by phone, whichever they prefer. So if they do all 5, that's $125.
Oh, wow. Okay. Okay.
Yeah.
That's great. Well, thank you so much, Amy, for sharing about this incredible program. It sounds like it's really exciting, and it's, you still have a month or a little bit more than a month to get some more folks enrolled so we can get more data to help demonstrate the value of a program like this, as I'm sure it sounds like people are already finding it helpful. So that's great to see that kind of feedback. So
absolutely. Yeah. So yeah, we have close to 2 months. We're at the beginning of January, so close to 2 months. So if anybody's interested, just get in touch with us, and we're happy to do a screening and have them join the program.
Okay, excellent. Well, thank you. If there aren't any more questions, I think we will adjourn.
Super. Thank you again, Jennifer. I really appreciate the opportunity.
Sure. Thank you so much. It was great to have you. Thank you.
Okay.